Policy and Advocacy of Planned Parenthood Hudson-Peconic, and today is the county executive's deadline to either sign or veto the clinic access bill. And so in these last moments that we have, people want to talk about why the county executive needs to do the right thing in front of this bill. And I'm going to start with Jill Scheuer, Chair of the Board of Directors at Planned Parenthood Hudson-Peconic.
Good morning, I'm Jill Scheuer. I'm Chair of the Board of Directors of Planned Parenthood Hudson-Peconic. Thank you for coming. We're here this morning because we are again calling on County Executive Astorino to sign the Reproductive Health Care Facilities Access Act, which was passed by the Board of Legislators last week. As you may know, on Sunday, the county executive told reporters that he was going to veto this bill. But signing the bill is the right thing to do for the women and families in Westchester. No one should have to walk through or around a line of protesters to face harassment and intimidation when obtaining health care. Yet too often, women and men seeking health care at a Planned Parenthood health center must do exactly that. During the public hearing, opponents of the bill, most notably those who protest outside our health centers, repeatedly misrepresented the facts about reproductive health care and the work of Planned Parenthood. As I did when I spoke at the hearing on April 30th, I want to set the record straight because it's important to understand that this bill is about the right of every person in this county to access the health care she or he needs from the provider that he or she chooses, and to access that care safely and without giving up his or her privacy. PPHP operates 5 healthcare centers here in Westchester County. We've been a part of this community for 79 years. More than 90% of the services that we provide are life-saving cancer screenings, birth control, STI testing and treatment, HIV treatment, testing, Pap tests, and breast health screenings. We provide prenatal care at several of our health centers, and we provide abortions. Regardless of how many times opponents of this bill lie about what goes on inside of Planned Parenthood, the truth is we provide women and men quality, affordable health care, and we give them information. The accurate, non-judgmental health information that they need to take care of themselves. The people who come through our doors know that they can count on that. That is exactly why they come to us. For many of our patients, we are their primary and sometimes their only healthcare provider. The atmosphere inside our centers and other women's health centers is warm and inviting. Yet in order to get into our centers, our patients have to face the gauntlet of protesters. This clinic access law will not stop protesters from protesting. They can, and no doubt will, still be there, shouting falsehoods, holding signs with hateful judging statements, and hurling incendiary language at people seeking care. This bill, however, will stop the protesters from following patients who ask to be left alone. It will prohibit the use or threat of force and other activities that cause a patient or healthcare provider to feel that they are in danger of physical harm. This does not violate the protesters' rights to free speech. Regardless of how County Executive Astorino may personally feel about birth control or about abortion, I'm urging him to take a stand for women in Westchester today. Please do not veto this bill as you threaten. Sign the bill, send a clear message that you care about people and their right to access to health care. That's what this bill is about. Thank you. And now I'm pleased to introduce Catherine Letter-Plaskett, President of WCLA Choice Matters.
Thank you very much. And thank you all for coming. I am Catherine Letter-Plaskett, and I'm President of Choice Matters. I'm actually here today to talk to you about the silent war that Mr. Astorino and his allies in the Republican delegation are waging against Westchester's women and their families. Today, I would like to think that the county executive will come to his senses and recognize this is in the best interest of the women and families of Westchester to pass this bill, but I'm not as hopeful as the women behind me. I have watched him carefully over the past 2 years that he's been in office, and it has been an out-and-out attack on all aspects of family life. Today, County Executive Astorino will veto the access bill passed by 10 members of the county legislature on May 7th. He made his intention clear in communication shared through an email distributed on May 16th by John Mark, an anti-choice extremist friend of Mr. Astorino's. Mr. Astorino will attempt to justify his action, citing a litany of trumped-up legal arguments that he rehearsed on Channel 12 over the weekend. These manufactured arguments have all been proven groundless by some of the greatest legal minds in the state of New York, as well as by the New York state law itself. The truth behind this veto is the war this administration and its allies in the county legislature have been waging on Westchester's women and families. Despite what Mr. Astorino and his followers would like you to believe, the clinic access bill is not about providers. It is about women. Your mother, your sister, your aunt, yourself. It is about women and safe access to good health care. It is about reproductive health care for younger women who need cancer screenings, contraceptives, and a full range of reproductive health care. It is also for senior women who are no longer in their childbearing years, but will receive pap smears, cancer screenings, and other things at these health centers. This is not about county tax dollars. It is about women and health care. This veto stands with other attacks by the administration and its allies in the Republican delegation. Astorino's hand-picked candidate, Sheila Marcotte, along with Mike Smith, Gordon Burroughs, and David Gelfarb, led the way in voting no to fund senior transportation. Just $15,000 of the county budget, and they voted no? Money allocated to transportation only for seniors, most of whom are women. Widowed women, divorced women, women living on a very limited budget, who are known to be on the edge, more on the edge than most of the population, senior women. They voted no to $15,000. Astorino has made it increasingly expensive for the working poor to qualify for child care. He has cut 4 after-school programs, which were receiving partial funding by the federal government. The list is long, but simple to understand. Rob Astorino has brought the war on women and our families to Westchester. And yes, Mr. Astorino should know this is very personal. It's personal to all of the women of Westchester and their families, and it's very personal to me. Thank you. I would like to introduce Maryjane Shimsky. She's the county legislator from District 12 and one of the sponsors of the bill.
Thank you, Catherine. We're here today because the people of Westchester County and the County Board of Legislators gets the issue of women's health care. I'd first like to acknowledge some of my colleagues. Linda Williams, Vice Chair of the Board, was here earlier. Ken Jenkins, the Chair of the Board, was hoping to get here on time. He probably won't make it, but he wants to reaffirm his support as well. Bill Ryan, Chair of the Legislation Committee, is out of town on legislative business today, but wanted to assure everyone that he's sorry that he cannot be here to stand four square with his fellow legislators on this. And I'd also like to acknowledge Peter Harcum, who is walking the walk on family issues today and staying home with a child who could not go to school. That's what a real family-centered legislator is all about, and we'd like to thank him for his support as well. This bill is about being able to keep women's health care easily available, convenient, and safe for the women and their partners and family members who need the care. Why do we need this bill now? Anyone who reads the newspapers knows that there is an increasingly hostile climate, not just to abortion rights, but to all women's health care. The United States Congress is trying to fund student loan forgiveness with cuts to pap smears and mammograms. This is turning into something far beyond what some people would make you suggest it is. Women need to get into these clinics for very, very good reasons, a whole multiplicity of reasons. And we need this bill to make sure that the entrance will not be blocked and they will not be threatened if they try to enter. At this time, I'd like to introduce my other co-sponsor, Judy Myers.
Thank you. Thank you, Catherine. I will be brief because indeed today is actually a very sad day for Westchester if indeed the county executive does veto this legislation. This is not flawed legislation as he would have you believe. This is legislation that once again is seeking to make access to a reproductive health care facility open for all. This is a sad day for Westchester, indeed, if it is one more element of Washington's war on women coming to Westchester. We've cut out so much of the child care funding that women can't work. We are now cutting out, this would be cutting out their ability to get into a reproductive health care facility for reproductive health care. It's a sad day for Westchester, and we haven't heard otherwise. But at this point, we have not heard yet that he has vetoed this legislation, and we are sincerely hopeful that he will not veto this very, very good piece of legislation. Thank you. I will turn this over to Alfreda Williams.
Thank you. I just want to add my comments by saying that it is a very, very sad day for Westchester if the county executive does this bill. Women's health is the most vital thing that's happening today in our country. And, excuse me, we know that not only is this an opportunity to show that this county is a forward-thinking county. We know the importance of women and women's health. We know the importance of child care and education for children in this county. And if we're not going to prohibit access to clinics, then we have done a wonderful, wonderful thing for our children. But we also know that if the children that are being born in this country because of lack of abortion rights, where is the health care and the education for these children? The county executive has shown that he has no allegiance to children because he doesn't care about child care, he doesn't care about child health. So what happens to children who are born through a system of instability for women and a system that guarantees that any child can be born, but no health care is provided and no education is provided? We need to stand together as women to make sure that our rights are protected, the rights of women to access to good health care, quality health care, and the ability for their children to have good education and also good health care. Thank you very much.
I'm Catherine Borgia. I'm a new legislator. I just took office in January, and I did want to become a co-sponsor of this legislation because for a number of reasons. I know that I had followed the history of this bill over the past 10 years, and I know that the people who were working on this bill took very seriously the input that they got with respect to protecting people's First Amendment rights. I think this piece of legislation does the perfect balance of protecting people's right to peaceful protest and protecting women to have access to the health care that they need. When I was talking about this legislation to my mother, who is a widow on a fixed income, 5-time cancer survivor, and 3-time breast cancer survivor, and a person who has been a long advocate for social justice issues, she said to me, "I'm so sorry. I'm so sorry that you're having to fight these fights again that we thought we took care of in my generation. I'm so sorry that in Westchester we see things that mimic the ugly behavior of some other Republican people in nationwide, where we've seen a lot of erosion of women's rights and women's standing. This is part of a much, much, much bigger issue about what's going on in our society. We cannot afford to devalue women's health, to devalue women's rights. I think it really behooves the county executive to understand this bill creates a balance. It allows people the ability to protest. Many of the people who came down to testify at our hearing testified about their own protests. All of the behavior that they described is protected protected under this piece of legislation. What this legislation does, though, is also protect women accessing these healthcare clinics. It's a common sense bill. It's right for Westchester, and we urge the county executive not to veto it. For this particular instance, and also to show that here in Westchester County, we value women. We believe they have the ability to make good choices for themselves. We value their health. We value their welfare, and we really want to see this bill go through. And I'm also pleased to introduce another freshman legislator, Judy Myers.
Thank you. Like Catherine said, my good friend and colleague, I too am a freshman legislator, 17th District, covering Southwest Yonkers. And also, you brought a good point. It's a really, really sad thing when we have to continue fighting for the rights that women like Catherine's mother fought for and thought that it was already taken care of. History will tell you that for centuries, women have always had to fight for the rights to something, for the rights for something. We had to fight for a right to vote. We had to fight for a right for equality, equal opportunity, and equal pay. And now, even though that is perfectly legal in this country, we have to fight for a right to see our doctor. A woman's work is never finished. Nobody has anything to say, more or less protest, when a man goes to see his doctor to get a prescription for Viagra, a medication that is used to enhance a man's sexual appetite and performance. But yet they do have a lot to say when a woman goes to see her doctor to learn more about safe sex practices. Nobody has anything to say, more or less protest, when a man goes to see a doctor to get a vasectomy, which is a method of birth control. But yet they do have a lot to say when a woman goes to see her doctor to learn more about her birth control options. This bill is not about Planned Parenthood and its services, just like it was not about the protesters and their rights. It was about a woman's rights to seek the medical care that she needs, deserves, and is legally entitled to. It was not about religious beliefs and practices, but about public safety. The safety of the protesters and the safety and security for the women seeking proper medical attention with a feel of physical harm and or intimidation. Today, I'd like to ask our county executive to please not veto this bill and to please let us continue having the rights that women really deserve. Thank you.
Yay. At this time, if anybody has any questions for any of the legislators or Catherine or Jill, please go ahead.
Actually, Lisa, there's one thing I would like to add. There's been a lot of discussion about some of the well-organized campaigns on this bill that have been taking places in certain churches in Yonkers and Eastchester. But I just want the people of Westchester to know that we've heard you, because the vast majority of people in my district who have commented on this bill have been overwhelmingly in favor of it. And I know that many of my colleagues have the same story to tell. This is something that the people of Westchester County support, as well as the legislature, and I hope it becomes law very soon.
Well, if there's no questions, again, thank you for coming.
Thank you so much.
Thank you.
Hey, John, how are you?